Guatemala City, February 1948. A woman named Berta lies on a bed in the National Psychiatric Hospital. She does not know why the American doctor has come to her ward. She does not know his name. There is no record that anyone asked her anything. He lifts her left arm. Into it he injects a pale suspension he has prepared himself. He writes the date in his notebook. He does not write what he has given her. In the notebook, the substance has a name: treponema pallidum, syphilis. Berta has 6 months to live. For most of them, the man who infected her will watch and take notes and do nothing. This is her case file. The doctor was John Cutler, an officer of the United States Public Health Service, the federal agency responsible for protecting American health. By the time he arrived, syphilis was no longer a mystery. Penicillin cured it. A person diagnosed with the disease could be given the drug and walk away well. That is the fact to hold on to. The cure already existed. The study was not built to find one. It was built to answer a different question: whether a chemical, applied in the minutes after exposure, could stop the infection from ever taking hold. Not a cure, a prevention. And to test whether you can prevent an infection, you first have to create one. That was the problem. To study prevention, Cutler needed people who were freshly, deliberately infected, with a disease that already had a cure, sitting in the same medical bag. In the United States, deliberately infecting a healthy person was not something the law or the profession would permit. So the study moved south. Between the U.S. Public Health Service, the Pan American Sanitary Bureau, and the government of Guatemala, an arrangement was reached. The idea did not come from Washington. It came from inside Guatemala, from Juan Funes, a public health official who had once worked alongside Cutler in a U.S. laboratory. He offered his own country's clinics, prisons, and patients. His government agreed and was paid for its part. American researchers were granted access to the country's prisons, its army barracks, its national orphanage, and its only psychiatric hospital. Inside those walls were people who could not leave and could not refuse. The work would go on for 2 years. It would remain unknown for the next 60. Cutler arrived in Guatemala in 1946. His first method was designed to look almost natural. Prostitution had just been legalized in Guatemala. Registered sex workers were required to visit a state clinic twice a week to be examined and tested for disease. That requirement became the study's first tool. When a woman tested positive for syphilis or gonorrhea, a bacterial infection of the mucous membranes, she was not treated. She was sent to Cutler. Paid and allowed into the prison, she had sex with the inmates. The men were never told what she carried. The women who tested negative were used differently. Before they were sent to the cells, the bacteria were applied directly to the cervix. To the woman on the table, the swab that carried the infection looks no different from the ones that tested for it. Either way, the disease was meant to pass the way disease normally passes. It did not work well enough. Infection through contact was unpredictable. Some men caught it, many did not. For a study, unpredictable was useless. So Cutler removed the contact and kept the infection. His team began applying the bacteria directly. They soaked cotton in a suspension of live syphilis and held it against scraped skin. They scratched men's forearms and pressed the infection into the wounds. On some subjects, they abraded the genitals first, to be certain the bacteria would take. The people this was done to were, in the study's own words, subjects: a prisoner in the national penitentiary, a recruit in an army barracks, an orphan, a patient in a hospital who had come or been brought for care. A 300-bed facility was built in Guatemala City to support the work. It existed to process the study's specimens and results. By 1947, the experiments reached the psychiatric hospital. Between May of that year and October of the next, 446 of its patients were deliberately exposed to syphilis. Some of them could not have understood a consent form if one had been offered. None was. Among them was a group of 7 women, all recorded as severe epileptics. For these, Cutler used a procedure called cisternal puncture, a needle driven into the base of the skull to reach the fluid around the brain and spinal cord. He drew the fluid out, then he injected syphilis directly into that same space. Berta was a patient in this hospital. Her records do not give her age or the illness that first brought her through the door. In February 1948, she was injected with syphilis in her left arm. A month later, she developed scabies, a skin infection caused by a burrowing mite. Then came red swellings at the injection site. Then, lesions across her arms and legs. Cutler noted, in his own hand, that her skin was beginning to waste from her body. She was not treated. 3 months passed. The disease he had put in her arm moved through her untouched. This was not an oversight. Withholding treatment was the observation. The point of the study was to watch. By late summer, Cutler wrote that Berta appeared close to death. He did not record why. On the day he wrote it, he did not treat her. Instead, he took gonorrheal pus from another subject and placed it into both of Berta's eyes, into her urethra, and into her rectum. He reinfected her with syphilis. Within days, her eyes had filled with pus. She was bleeding from her urethra. Then Berta died. She was one of 71 patients at the psychiatric hospital who died during the period of the study. The records draw no line between the deaths and the experiments. The records were not built to draw that line. Berta was never meant to be the whole story. She was one half of it. The design had 2 groups. One was infected and then given a chemical meant to stop the disease before it could take hold. An arsenic-based wash, or penicillin, the same drug already known to cure. The other group was infected and given nothing. Without the second group, the first proved nothing. To measure whether a preventative worked, the study needed bodies in which the disease was allowed to run. Berta was never given the drug. Her death was not a failure of the experiment. It was a data point. Cutler left Guatemala in December 1948. In 2 years, his team had deliberately infected 1,308 people. Of those, 678 received some form of treatment. The rest are a number without a footnote. He filed no public report. He published nothing. He carried the notebooks home. The Guatemala study is often read as the work of one cruel man. That reading is too comforting. Cutler did not act alone, and he did not act in secret from his own institution. The study was designed inside the United States Public Health Service, funded through the United States National Institutes of Health, and coordinated with an international health body and a national government. At every level, people with authority knew what was being done, and to whom. What made it possible was not cruelty. It was a boundary. Inside the United States, a healthy citizen had something the study could not work around: the ability to say no. That single power, consent, made the American population unusable for an experiment that required deliberate infection. Guatemala offered populations without that power. A prisoner cannot leave the room. A soldier is under orders. A psychiatric patient may not be able to understand the question, and a child cannot answer it. The people were not chosen because they were available. They were chosen because they could not refuse. This is the shape the case reveals. The ethical rule against infecting people was never overturned or argued away. It was simply routed around by moving the experiment to a place where the people it would use had no standing to object. The same logic connects Guatemala to another study. The Public Health Service also assigned Cutler to Tuskegee in Alabama, where hundreds of Black American men who already had syphilis were watched, untreated, as the disease ran its course. A study that had begun before Guatemala and would continue for decades after. Two of the most serious human experimentation cases in American medical history share one investigator and one employer, not because he was unusually monstrous, but because the same agency kept moving him from one population that could not refuse to the next. The failure was never contained to a man. It was contained to the people who could not say no. Berta has no grave anyone has found. Her surname was never recorded. What is known of her exists only because the man who killed her wrote it down. That is also how the study itself survived. Cutler kept his papers. After his death in 2003, they sat in a university archive. A historian named Susan Reverby, researching the Tuskegee study, found them there. The patient records, the notes, the photographs. In 2010, the Guatemala experiments became public. 60 years after they ended, brought to light by accident in the belongings of a dead man. The response came quickly. The United States government issued a formal apology to Guatemala. A presidential commission investigated and concluded the experiments were a serious ethical violation, judged even by the standards of their own time. No one was prosecuted. Cutler had died with his reputation intact, having held senior positions in public health and at a major university. Survivors and families filed suit against the US government. A federal court ruled the government could not be sued for acts committed abroad and dismissed the case. No compensation fund was ever established. The apology went to a government. It did not reach Berta. The rule was never that you could not infect a healthy person against their will. The rule, in practice, was that you could not do it to someone whose objection would count. And so a government went looking for people whose objection would not. The same investigator ran a second study at home on black men in Alabama, untreated for 40 years. That file is already on this channel, the Tuskegee experiment. The next case, a military surgeon who served for decades, respected and unquestioned, and whose body, after death, told a story no one had been allowed to know. Subscribe, and the next file opens for you first. This is the sealed ward.